So the question of whether COVAX, what is the future for COVAX given the experience to date, I think it's important to understand the experience to date as we think about what the world needs for the future. COVAX was an emergency mechanism that was set up in the midst of a crisis in anticipation of exactly the dynamic that we have seen unfold, which is that high-income countries securing vaccine for themselves and not taking steps independently to guarantee that vaccine be shared equitably globally at the same time. And so COVAX was set up very rapidly in the spring and summer of 2020. We had to go out and secure funding for it. And the time that it took to set that up, to design it, to secure participation, to secure funding for procurement of vaccines, resulted in COVAX not being at the front of the line for the first vaccines that became available. I think it's important to understand how COVAX has succeeded just as well as the areas in which it has struggled. And COVAX as a mechanism has demonstrated that it can deliver vaccine at scale to a vast number of countries. At this point, we have now delivered around 1.2 billion doses to, I believe, 144 countries. If you take the China and India out of the equation from the vaccines that they made in their country and used in their populations, there have been about 6 billion doses of vaccine delivered globally. So COVAX has actually delivered about 20% of the global total, even with the very late start that it had. And in December, we delivered, I think somewhere around 330 million doses were delivered. So the capability, COVAX as a mechanism to move vaccine is working, but it ran into real challenges early in its effort because of restricted supply. And so I think as we think about the future, does the world need a COVAX-like mechanism for future pandemics? It probably needs some kind of mechanism to distribute vaccine equitably, but it also needs to look at why we have the outcomes that we have observed. And I think the core underlying reason that we've observed those outcomes are a couple. One, vaccine manufacturing was concentrated in just a few regions of the world, and regions with very high populations. Two, there weren't emergency financing mechanisms in place that were willing to take the kinds of risks that one has to take at the beginning of a pandemic. I would say a third factor, this is something that CEPI, my organization, is working on, is vaccine development takes too long. Even what we achieved in 2020 was too long, so we need to compress vaccine development timelines. So the solution, I think, is a COVAX-like mechanism that is modified in light of our experience. We need to be open-eyed and quite objective about what went well, what didn't go well. It's going to need a little bit of re-engineering. We need globally and equitably distributed manufacturing capacity. More than anything else, we need to have a global network of manufacturing sites that have access to the latest technologies and can rapidly begin to produce vaccines in the future. And we need to compress vaccine development timelines. CEPI's goal is to compress those timelines for a real crisis down to as little as 100 days. So the case for vaccine development, and particularly for developing capabilities to respond to epidemic or pandemic threats, has historically been challenging because the nature of the threats, they're episodic, they're hard to predict, you don't know if there's going to be a real market for the vaccines, and so the private sector left to its own devices has at least before COVID, has neglected these threats. I think what's interesting in response to COVID, we have seen companies making extraordinary, those who've been able to deliver vaccines, and I'll say they had to take a lot of risks to undertake the vaccine development effort, and now they are reaping very substantial rewards, and without debating whether those are just or equitable. But what the private sector has seen is that preparedness can provide financial rewards. And so the private sector is beginning to understand the value of having capabilities to respond rapidly to threats. I don't think that's going to be enough to give us the capabilities that we need, however, and I think it's really important that governments properly appreciate the scale of the threat we face, the nature of the threat we face, the fact that it's recurring, that it's unpredictable, but that we are seeing infectious disease crises and in global infectious disease crises more frequently now than we did in previous decades. Governments are going to have to invest in the capabilities to respond to biological threats if we don't want them to undermine our societies and our economies and cause potentially untold numbers of deaths in the future. So in my mind, while pandemic preparedness certainly has elements in which it is a health problem, and certainly has elements for many countries, and particularly countries in Africa, where it is also a development problem, I don't think fundamentally should be viewed as a health problem or a development problem. I think it should be viewed as a security problem, and we need to think differently about how we finance global health security. So that's the argument that I'm making to governments. I'm also obviously making that same argument to the private sector partners, and I think in the future we have an opportunity, because of this experience that we've all been through, to actually see substantially more attention paid to this problem. So CEPI has laid out this goal of developing vaccines, shortening the timelines to develop vaccines to as little as 100 days. Can we do that? And how do we do that? And how do we enable that? Those are critically important questions. And how would we enable that kind of capability in the African context, in Nigeria, for example? Let me start by just saying the reason we need to be able to develop vaccines that rapidly is obviously to substantially mitigate the impact of pandemics. If we had developed vaccines in 100 days in the context of COVID, we would have, we would have begun to roll out vaccines as early as April of 2020, and you can imagine that would have resulted in a reduction in the number of deaths, severe illness, the economic impacts. So that's one of the rationales. An even more aspirational idea that I have, and which I think really speaks to the question about what does this mean for Africa, is if we can develop vaccines within 100 days, and that capability is coupled both to an ability to scale up that production rapidly, but also coupled to better surveillance, earlier detection, earlier warning about threats, earlier sharing of information, and empowered public health authorities who can rapidly respond to try to suppress disease transmission. If you can couple those two capabilities with the rapid delivery of vaccines and ideally therapeutics and certainly diagnostics within a very compressed time frame, I think the world actually has a fighting shot, not just of mitigating future pandemics, but preventing them all together. And given the cost of the pandemic that we've just been through, I think that is worth a very substantial amount of investment. So what does that mean for Nigeria? I think Nigeria has already demonstrated that they've been able to improve their surveillance systems. I mean, we see this with Lassa fever, with monkeypox, the increased rates of detection. We need to really invest heavily as a world in making sure that we don't have weak links where surveillance is concerned. And so Nigeria needs to continue to build on its surveillance capabilities, and it needs to continue to support its public health institutions, both at the national level in the form of Nigeria CDC, but also at the local level. And if Nigeria can do those things while we're evolving these technologies to rapidly develop vaccines, I think we have a prospect for beating future pandemics altogether. So what do we need to be saying to our political leadership to make sure that they are prioritizing these threats appropriately. I think Peter Sands, who's the head of the Global Funds, famously said a few years ago, he talked about the cycle of panic and neglect that we have observed, when an infectious disease crisis occurs and then when it goes away. And there's panic while the infectious disease is prevalent, and when it subsides, people forget about it, they don't take the necessary steps to learn the right lessons, and they move on to other things. And I'm actually quite concerned that we may see a similar dynamic even with this event, as huge as it has been in terms of its impact, a number of people that have died from COVID, the economic impact. I just came back from the Munich Security Conference, which was dominated, as I think people would understand, by concerns about Ukraine. I mean, we're still in the midst of a pandemic. Germany is just emerging from a tremendous wave, Omicron wave of the pandemic, and yet all of the attention was focused on Ukraine. I think there is a certain limitation of bandwidth at the very top of governments. There are only so many crises they can focus on at a time. But the important lesson, the thing that I think we need to say to the political leadership, is that infectious disease threats are a constitutive aspect of modern life because of the way modern life is organized, because of the way we are now all biologically interconnected, because of trade, travel. There are other factors that are increasing opportunities for pathogens like climate change and changes of the animal-human interface. And all of the trend lines are going in a direction that would speak to greater risk in the future rather than reduced risk. And COVID, by my count at least, represents the 7th global infectious disease crisis just since the turn of the century. And I mean, that's SARS, avian influenza, swine flu, MERS, Ebola, Zika, and now COVID. And when you remind political leaders that these kinds of crises are occurring every 2 to 3 years, maybe they will internalize that governments, just as they have invested in cybersecurity to address computer viruses in a digitally interconnected world, they need to invest in biosecurity to address real viruses in a biologically interconnected world. How is CEPI actually going to support vaccine development besides just conducting clinical trials in countries where some of the diseases that we're working on are prevalent? I mean, our work here in Nigeria with Lassa fever is a great example of that. We have supported in Nigeria and in other countries in West Africa what we believe to be the largest epidemiological study of Lassa fever ever. That study is ongoing right now. It's going to help us with the design of clinical trials. It's also, I think, going to help us prepare clinical trial sites for the conduct of vaccine clinical trials when the vaccines are ready for larger scale testing. But over and above just performing the clinical trials, I think we need to have a world where all the regions of the world can actually perform research and develop vaccine products to meet their own needs and actually achieve vaccine self-sufficiency. If the world can achieve vaccine self-sufficiency, we would not see the kinds of inequity that we have seen emerge during COVID with respect to access to vaccines. CEPI, as we look towards our next 5 years and are thinking about our CEPI 2.0 strategy, a major piece of that strategy is in focusing on extending manufacturing production capability, but also helping countries that are trying to achieve vaccine manufacturing, and Nigeria certainly being one among those, to invest in the kinds of workforce capacity that will be required, to invest in regulatory capacity, to invest in the kind of quality systems, the ecosystem around the manufacturing facility itself. And that, coupled with the further evolution of the clinical trial capability and the surveillance and detection capability, will begin to, I think, create a virtuous cycle in which Nigerian science can really effloresce and contribute to solving this global problem.